The past few months of our life have felt like no other, and there has been so much noise and information out there.
Toughest restrictions on our way of life in living memory.
To slow the spread of the disease.
Bringing the total number of deaths to 41,481.
When we first went into lockdown, it felt like coverage was rightly focusing on death rates and social distancing. But I remember at the time there was one hidden headline I found buried away that really made me sit up and take notice. The UN says that COVID-19 could set women back decades on gender equality.
Alongside the health emergency, we're really seeing an epidemic of hidden harm against women and girls.
Women so far seem to be taking a bigger pay hit than men. What does that mean? Well, we've already got a gender pay gap of about 18% for all workers. So it could take, literally decades to get back to where we were before this crisis.
Over the past few weeks, I've spoken to women on the phone, over email and from a distance from all across the UK. For the women I've chatted to, isolation has caused new problems, but for most, it's just exacerbated the issues and inequalities that already existed in their lives.
Hello?
So it is week 2 of lockdown. Currently, we are only allowed out of the house once a day for a little bit of exercise. But for women like Kate, the home is a place to fear. Being trapped in a marriage you were just getting ready to leave after years of emotional abuse. She hasn't really felt comfortable to talk to me on the phone because she's obviously at home with him, but we've been emailing over the past few weeks. Kate said after she had her son, things got pretty bad quickly and have continued to get worse and worse. She said, "This has been an extremely hard decision to make and I'm so scared. There are so many things to think about. I want my son to know his dad, but I need to know he's safe doing so." What were your initial thoughts when lockdown was announced? She said, "My heart sank. I was so relieved when I found out he would still be working. This allowed my son and I to have some quality time together. When I found out that he was being furloughed, I felt sick. I rang my mum as I didn't know when I'd next be able to stop holding back the tears. I'm unsure what mood he'll start each day in. I'm shattered, worrying, and wondering is draining." I was emailing Kate for months during lockdown. One day she called me to say her partner was out for a last-minute job and she wanted to meet in the park to talk about leaving her marriage during a pandemic. We've used an actress to protect her identity.
Whenever I bring up about him being controlling, I get different answers. Before it'd be like he'd have to know where we were going, and then it got to the point where he didn't want to know anything. He wouldn't ask us or his son anything about how his day had been. But I just finally feel ready to get on with this new chapter for us both. I think my son will realise himself in time. If I don't do anything about it now, it's already getting worse and worse at home, so I don't see it ever getting any better. He can't flip a switch to all of a sudden become Mr. Nice Guy.
How aware do you think he is of how you feel and how he treats you?
Well, we had a massive argument on Sunday. In the end, I just put tea on the table and ended up having to leave with our son. He'd upset me that much that I just couldn't be there. He just made me feel awful and like I just wasn't worthwhile. I don't want to stop our son from seeing his dad, but when we leave, I don't think he'd hit him or anything, but he's thrown stuff at me when I've been holding him. You just don't know, do you?
We've seen that very little data actually is being collected on the impact of this crisis on disabled women. We were able to publish some analysis of the impact on disabled women and found that they were the ones reporting extremely high levels of anxiety, much more likely to say they've lost support during this crisis.
Hello?
Hey Jess, how are you?
I'm okay, how are you?
So prior to the full lockdown measures, I was living in a mental health recovery house, and I was under a lot of treatment teams that have been dissolved, obviously, under coronavirus. I was put into emergency council housing, which I wasn't meant to live in until I had a carer, and until there were adaptations in place.
I've been speaking to Jess for a few months after she had a coronavirus outbreak in the mental health recovery house she was living in. The local council moved her into temporary accommodation and say that they've been actively trying to move her into a new premises during the pandemic.
As livable a space as possible, I've pushed my table against the wall to try and make my wheelchair usable inside. But at the end of the day, it's just not suitable or adapted to my needs. Like the bathroom is too small to fit my correct shower chair in.
Any issues that I flagged were dismissed, and I think a lot of women obviously go through that of being sort of like almost gaslighted and dismissed.
In a statement, Barnet Council said,
"In the event that accommodation is unsuitable, the council works with this individual to address this through adaptations or securing alternative accommodation."
This is a little bit oversharing and depressing, but I've had like a few instances of like overdoses in the last couple of weeks, and haven't reached out for help for some of them. Being intentional, but not with the intention of dying when I'm in a situation where a crisis like that is taking place. I have sort of a limited window in which to safeguard myself, and sedation becomes the only option in these situations.
Yeah.
And sedation obviously takes the form of, unfortunately, overdoses. The safety nets that would be in place have all gone, and the risk levels have increased as well, which is very alarming.
For the most marginalised women living in the most difficult circumstances, being trapped in their homes, being unable to reach out to those social networks in the usual way can mean and feel very different to others. And it's really important that that is recognised in the ongoing response to coronavirus.
At the moment in lockdown, one of the only things we can do is exercise. And I've been seeing a lot of talk on Instagram about coming out of this with a lockdown body. Around 1.25 million people in the UK have an eating disorder. 75% of them are women. And it's made me wonder what this period of time is doing for women that struggle with body image and control.
Hi Helen, it's Amber here. How are you?
Hello. Alright, thank you. I have anorexia, so it's obviously a completely restricting, controlling.
Yeah.
It's all around routine. But obviously all that taken away, which was all taken away at once, you're left with nothing. So I just took all the food away. If I do eat anything, it's only usually the corn cakes, and because when it first happened, everyone seemed to panic buying, so I went to the shop, which usually you don't have trouble buying corn cakes because most people think it's like eating fresh air. And all the shelves are empty. I'm thinking people buying them, they're probably just sat in their cupboards at home just in case.
Yeah.
And there's people that survive on those foods.
Helen's recovery programme had to be paused during COVID. Her therapist had been helping her relationship with food and exercise, but over the lockdown, Helen's weight dropped even further.
I say everyone is suffering in so many different ways, and the world doesn't know about it. The whole thought process, to me, it's like the volume of those voices have doubled.
And what kind of thoughts would you say it puts in your head?
So if I haven't done certain things in a day, then it's always repeating, you haven't done it, it's not good enough, you don't deserve to have that later, as in the food, you haven't put in effort. And it's all about worthlessness and not being good enough, and perfectionism. Sometimes I just think, hang on a minute, I can't do this anymore.
Whilst also being more likely to die of coronavirus, Black and Asian women have also reported worse financial and psychological consequences during this pandemic. Just under 50% of BAME women, compared to 34% of white women, said that they'd lost support of another person or had felt socially isolated during this lockdown. And for some BAME mothers like Imani, they've had to make the ultimate sacrifice to carry on working on the front line during this pandemic.
Yeah, as a single mum, when I found out that we had to lock down, I had to, consider that I would have to continue cleaning, and so I'd have to lock down away from my daughter in order to keep up with my cleaning obligations. Wanting to see my daughter and talking to her on screen, but not being able to touch her, not being able to hug her, and just keeping up the morale on screen, and then I would come off screen and cry because I couldn't hold her or be with her.
So I think there's been a lot of talk lately about how people from ethnic minorities do a lot of the frontline, low-paid work. Do you think that moving forward, that's something we need to recognise more in society?
Yeah, I do. I think that it has taken something like this pandemic for it to be recognised. They don't have the luxury of saying, I'm going to lock down and I'm just going to, forget about work. And, like myself, it was just like, okay, as long as it's still okay for me to go to work and the government is not saying that I can't work, I'm just going to keep working because I literally have to.
What all of this evidence shows is that we have an approach from government which has been gender blind. They have not thought about the impact on women from the start of this crisis. We need to use this crisis as an opportunity, and we have to seize the moment to increase pay, improve conditions, and get all of us back into normality and all of us back to work. And that means not leaving women and girls behind.